Instilling nose drops. Gather the equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for the patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Unlock the medication cart or drawer. Enter passcode and scan employee identification if required. Prepare medications for one patient at a time. Read the medication administration record and select the proper medication from the patient's medication drawer or unit stack. Compare the label with the MAR. Check the expiration dates and perform calculations if necessary. Scan the barcode on the package if required. When all the medication for one patient had been prepared, recheck the label with the MAR before taking them to the patient. Replace any multi-dose containers in the patient's container or unit stock. Lock the medication cart before leaving it. Transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Ensure that the patient receives the medication at the correct time. Identify the patient using the treatment notes. And compare information with the MAR. Check the name and identification number on the patient's identification band. Ask the patient to state his or her name. Or verify the patient's identification with a staff member who knows the patient for the second source. Complete necessary assessments before administering medications. Explain the purpose and action of each medication to the patient. Perform hand hygiene and put on gloves. Provide patient with paper tissues and ask patient to blow his or her nose. Have patient sit up with head tilted well back. If patient is lying down, tilt head back over a pillow. Draw sufficient solution into a dropper for both nares. Do not return excess solution to a stock bottle. Ask the patient to breathe through the mouth. Hold the tip of the nose and place the dropper just above the nares, about 1/3 of an inch. Instill prescribed number of drops in one nares and then into the other. Protect dropper with a piece of soft tubing if patient is an infant or young child. Avoid touching nares with the dropper. Have the patient remain in position with head tilted back for a few minutes. Remove gloves and perform hand hygiene. Assist the patient to a comfortable position. Evaluate patient's response to the procedure and medication. Then document the procedure into the patient's chart. What a wonderful